Good afternoon, everyone. I'm Nirav Shah, the Director of Maine's Center for Disease Control and Prevention. I'm joining everyone this afternoon to provide an update on where we are with COVID-19 across the state of Maine for today, Wednesday, December 16th, 2020. And I begin, as I often do these days, with today's briefing on a sad note. Maine CDC has received the notice of the deaths of 2 additional individuals who have passed away with COVID-19. One was a woman in her 80s from Androscoggin County, and the other was a man also in his 80s from Oxford County. We'd like to take a moment to wish all the friends, family members, and community members of both of these individuals our deepest condolences during this time of grief. Right now in Maine, there are a total of 17,311 cases of COVID-19 across the state, representing an increase of 551 new cases, a new one-day high mark with respect to the number of new daily cases of COVID-19 that we've had. Of those cases, 15,142 are confirmed and 2,169 are probable cases. Cumulatively, 934 Maine people have been hospitalized at this point, and right now in Maine, 187 people are currently in the hospital. Of those 187, 46 are in a critical care unit, and 18 are on a ventilator. Sadly, 267 people have died with COVID-19 since we recorded our first case. And among all of our cases now, 2,028 are among healthcare workers. Currently in the state of Maine, there are 110 critical care unit beds that are available and staffed. In terms of where we stand with respect to outbreaks, we have opened a number of new outbreak investigations across the state just since the last time I spoke with you. Those include at the Cut Loose Salon in Norway, where we are aware of 3 cases, at Dirigo Elementary School, 6 cases, at Falmouth Elementary School, 5 cases, at Gilbert's Chowder in Windham, 3 cases, at Bonnie Eagle Middle School, 7 cases, at Cozy Harbor Seafood, 5 cases, at the Cumberland County Jail, 4 cases, at iCare Maine, 3 cases, at the Newport Town Office, 6 cases, at the Songo Lock School in Naples, 6 cases, and at Springbrook Center in Westbrook, 4 cases. I'd like to turn next to an update on where we stand with respect to testing across the state. Right now in Maine, for PCR tests, our 7-day positivity rate stands at 4.64%, and our PCR testing volume stands at 599 PCR tests for every 100,000 people. With respect to antigen testing, our antigen testing positivity rate on a 7-day basis now stands at 5.13%, and our antigen testing volume stands at 137 antigen tests that are being conducted for every 100,000 people. There has been some degree of stability with respect to both the positivity rate as well as the testing volume just in the past few days. Before I turn to questions, I wanted to start what I hope will be an occasional series. With the introduction and now the emergency use authorization of the first COVID-19 vaccine from Pfizer, as well as this week, another FDA advisory committee listening to and evaluating the evidence on a second potential COVID-19 vaccine candidate, we at the Maine CDC have started receiving a number of questions, both about the vaccine as well as about the vaccination process. So what I wanted to do from time to time is to consolidate the most frequently asked questions that we receive and try to make sure that I was providing straightforward, honest answers based on what we know right now. So I'd like to start that today. And there are so many questions that are out there right now. We will endeavor to do our best. I will endeavor to do my best to answer those from time to time. But what I would ask everyone to do is to do the things that folks have already been doing. Please keep sending in those questions. And as themes emerge and we see certain questions being asked more frequently than others, we'll put them in rotation so that we can make sure we are answering everyone's questions, because given where we are right now with respect to COVID, we know there are more questions than there are answers. We will try to do our best to fill that void and provide truthful, honest, scientifically based answers for all of your vaccine and vaccination questions. So we'll start that off. And one of the most frequent questions that I've received just in the past few days is, how do these vaccines work? Well, the vaccine that's been authorized, that's manufactured by Pfizer, as well as the vaccine that's being evaluated, manufactured by Moderna, both use a similar mechanism to stimulate the body's immune system to provide protection against COVID-19. They use a molecule to prime the immune system. That molecule, known as mRNA, is packaged in a bubble that can fuse to a cell and allow the molecule to slip in. The cell then uses that mRNA, which stands for messenger RNA, to make proteins from the coronavirus, which actually stimulate the body's immune system. Basically, what these vaccines do is enable the body to make a protein that our bodies themselves recognize as being potentially associated with the coronavirus, and then enable our body to start creating our own immune system response to the virus. Now, while immune system protection from these vaccines may last for months and hopefully even years, the little piece from the vaccine that is slipped into the body, that mRNA, does not last that long. It's actually destroyed by our own cells within a matter of days. Probably the second most common question that I've received is, what are the side effects of this vaccine? Well, first of all, the way that the vaccine is administered is via an injection that you have to do twice into your upper arm, right in your shoulder. Now, the injection into your arm won't really feel any different from any other vaccine that you've received. Tens of thousands of people have already received the Pfizer vaccine, and thankfully, none of them has reported any serious health problems. There are side effects, though, and sometimes they actually resemble the symptoms of COVID-19. That is actually a sign that your body's immune system is doing what it should and responding in such a fashion to prime the pump, to make sure that the next time your body sees the actual coronavirus, as opposed to a fragment of it, your body is ready to respond. Those side effects, which include things like feeling tired, fatigued, maybe a slight fever, they last about a day, and they seem to be more likely after the second dose, not the first dose. Early reports from some of the vaccine trials have suggested that some people might need to take a day off of work because they feel pretty lousy after they receive that second dose. For example, in the Pfizer study, about half of the folks developed fatigue. There were other side effects too that occurred in roughly 25 to 30% of people. And those included things like headaches, muscle pain, and in some cases, even things like chills. Another question that I get a lot is, can the Pfizer vaccine or the Moderna vaccine actually or accidentally give me COVID-19? The answer is no, it can't. The vaccine, neither of these vaccines uses a form of the virus at all. What they do use is a form of that molecule, mRNA, that primes your body's own immune system so that if you encounter the coronavirus out in the community later on, your body will be ready to defend against it. But the vaccine itself does not contain any of the live virus that causes COVID-19. And thus, you cannot get COVID-19 from the vaccine at all. A question that I know is on everyone's mind is the long-term safety of these vaccines. I've talked a little bit about the short-term safety. Thankfully, there were no serious consequences or adverse events in the short term. But a very common question I actually got it from a gentleman I was having a call with this morning, who said, well, wait a minute, what about the long-term safety? How do we know that it's safe in the long run? And so let me first start by just walking through how the vaccines were studied and developed. Both Pfizer and Moderna's applications to the US FDA both included 2 months of follow-up safety data from their massive phase 3 clinical trials. These trials were conducted by independent bodies, for example, or included arms that were conducted by independent bodies, like scientists at universities. In these massive trials, tens of thousands of volunteers got a vaccine and then waited to see if they became infected. And then they compared that with other volunteers who didn't get the live vaccine, but they got saline instead. By September, Pfizer's trial had enrolled 44,000 people, and there were no serious safety concerns that had been reported. But let me speak more personally and honestly about this question around long-term safety. Here's what I'll tell everyone. When it is my turn to receive one of these vaccines, I am going to do so. I've urged my family to do so, and they have told me that they will. I've asked my mother to do so, and she has told me that she absolutely will. That's the advice that I'm taking for myself. It's also the advice that I'm giving to my family. The other thing to keep in mind about side effects from vaccine is that most of the side effects that occur after a vaccine happen in the first few weeks, not usually years and years later. If there are to be side effects, they typically manifest in the days to weeks after a first or second dose, not in the years and years after that dose. But the other thing that we all have to be honest about right now is balancing that risk. Because right now, where we are in Maine and in our country, is that the risk of COVID-19 is clear and present and right in front of us. I'm speaking to you, for example, on a day when we've logged the highest number of one-day cases ever. We have to balance the risk of COVID-19 from any of the theoretical risks that might occur years from now in the long term with the vaccine. The risk that is facing us squarely in the face right now is the risk from COVID, not the vaccine. And finally, one of the other questions that we get quite a lot is around just the mechanics of the doses themselves. Both the Pfizer and the Moderna candidate, if the FDA authorizes it, requires two doses. And those doses have to be spaced out over a period of a few weeks. The other thing to bear in mind is that if you get one dose, your first dose of, say, the Pfizer vaccine, you have to get your second dose also of the Pfizer vaccine. Similarly, if you get your first dose from the Moderna vaccine, you have to get your second dose also from the Moderna vaccine. Which takes me to my last question of the afternoon. How am I supposed to keep track of all of this? Well, when you get vaccinated, you'll be given a card, a reminder, that tells you when you got vaccinated, where you got vaccinated, which type of vaccine you got, so you know what to come back and get for your second dose, as well as when you need to come back for that second dose. All of that information will be provided to you at the time you get your first dose. So you won't have to remember which one you got and what the lot number was. It will all be furnished to you. Now, there's a lot going on right now with respect to COVID-19, as well as vaccines and vaccinations. And there will certainly be more questions. I ask everyone to keep those questions coming. And from time to time, we'll take a couple minutes during these briefings to make sure that every single question that we get that is common, that's being asked by a lot of people, that I am able to provide you straight, up-to-date answers on. So with that, we're going to turn things over to our colleagues in the media. The first question for the afternoon goes to Bob Evans from News Center.
Good afternoon, Dr. Shah. We are getting reports that people are calling public safety offices and asking first responders about COVID-19 vaccinations. How would you simply advise our viewers about when, where, and how they can or will get the vaccine?
Sure, Bob. We've received many of those calls as well. Let me first say that it's uplifting and heartening that so many folks across Maine are calling and seeking more information about the vaccine, as well as when they can get vaccinated. Right now, unless you are a healthcare provider who works, for example, in an emergency room or in an ICU or on a COVID unit, it may be many, many months before there is enough vaccine available nationally in order for us to be offering vaccine to folks who don't have other pre-existing health conditions, or folks who, for example, don't work in a healthcare setting. So what I would ask everyone right now to do is, the best thing you can do right now is to stay up to date on where things stand with the vaccine. Keep on top of which vaccines have been approved, what the numbers are looking like, and tune in to, for example, these outlets like the Maine CDC's briefings, so we can keep you up to date on when vaccine might be coming your way. But right now, I don't advise, and in fact, ask everyone not to call your local public safety, not to call your local fire rescue or EMS agency. Those phone lines, we're really hoping they can stay open for first response and emergency purposes. Vaccine will be made available to the general public, but it may be many, many months away. Bob, before I turn to the next question, there's a really important part of today's update that I failed to provide. And that is, how many people got vaccinated in Maine thus far for COVID-19? I apologize for leaving that out. As of about 18 minutes ago, roughly 475 Maine people have already been vaccinated with the new Pfizer vaccine. Those vaccines are again occurring in healthcare facilities who are among the first to receive the vaccine, and those who are being vaccinated are healthcare providers who are at the highest risk of being exposed to COVID-19. Again, this includes folks like emergency department staff, ICU staff, and the staff who work in and around COVID-19 units. Again, that number is changing as I speak, because vaccine clinics are occurring at hospitals across the state as we are speaking. Right now, as of a few minutes ago, the number was approximately 475 people who have already been vaccinated for COVID-19, and that number will continue to rise. By the time we're done with this briefing, it will be even higher.
Dr. Shah, one more question. As you mentioned, we crossed over the 500 case mark today, a record that none of us wanted to see, but do you think we're hitting the Thanksgiving effects now? And if cases continue to grow, what might the upcoming holiday do to case numbers?
So Bob, I think we are squarely seeing the effects of transmission that occurred in and around Thanksgiving. It's not just Maine, it's across the country. Case numbers are going up and up and up. It does not augur well for the holidays that are coming up next week and the weeks thereafter. The reason is that, as we've all seen with COVID, where you start dictates where you end up. If you go into a season where more people are expected to be gathering in close quarters for long periods of time, if you go into those days, those holidays, with higher rates of disease, the likelihood that any one of those gatherings could be attended by somebody who has COVID itself goes up. This is almost exactly how exponential growth happens. And in our case, it's how exponential growth continues. I'm concerned about the holidays later this month. Even though I know they are a time of family gathering, if staying home, if staying in your pod, in your bubble, is something that's available to you, that's definitely the most healthful thing you can do this winter. I'm going to turn over to Ashley Blackford next.
Hi, Dr. Shah. I have a couple questions from viewers. The first one, if someone has had the coronavirus, do they still need to get the vaccine?
Ashley, I'm not chuckling because it's a funny question, but as I was preparing my notes for today, I had to pick a cutoff question that I would get to next week. And the first question for the next time I do this was going to be, if I already had COVID-19, do I still need to be vaccinated? And the answer is yes. Federal health authorities and the scientists who studied and developed the COVID-19 vaccine recommend that even if you have had COVID-19, you do go get vaccinated. The reason is that although the body's immune system is activated after you've had COVID naturally, there are good data to suggest that the power of immunity that you get after a vaccine may be stronger than the immunity that you get from just having had COVID. So for that reason, the scientists who study and have developed the vaccine, as well as scientists I've spoken with at the CDC, do recommend getting the vaccine, even if you've had COVID.
Okay, and my other question, case numbers are obviously on the rise right now, but the number of recoveries seem to be lower in comparison to what they were a couple of months ago. Are you able to kind of speak to that?
Sure. Case numbers are absolutely going up. But because of some changes that we've made to our case investigation, we don't always have the opportunity to check in with folks at the tail end of their disease to get a good sense of whether they've recovered or on what timeline. For that reason, that number doesn't have the same force that it did earlier. So that's one reason I don't report out on it as much. But certainly folks are still recovering. I just don't have the data to show what those numbers are with precision and with accuracy right now. I am going to turn next over to Brian Sullivan at WABI.
Thanks, Dr. Shah. I wonder if you could just first offer a quick update about cases that are linked to the Stetson Memorial United Methodist Church.
Yep, up in Patton. Yes, we're aware of that situation, Brian, and our case investigation, our outbreak investigators are gathering data around that outbreak to try to determine what might be the connections between that outbreak and any other cases in and around that area in the county. We are sadly aware of one individual who may have tragically passed. Can't confirm that right now. We're investigating that right now. But at this time, Brian, I don't have any further updates other than to say that our outbreak investigation is ongoing.
Okay. And I also saw a report that the White House Coronavirus Task Force had designated Maine as a red zone now, which I guess is in line with every other state, I think, other than Hawaii, and possibly recommending stronger restrictions. Can you just talk about that a little bit and what's coming from the national level and what those restrictions might look like?
Sure. Maine, as you sort of noted, Brian, was among the last states, second to the last state right now, to be designated as part of that red category. It's a testament to how well and how long we were able to hold out. But even in light of the great work that we did as a state, the forces of COVID were just quite strong. And so Maine has flipped into that category. It's unfortunate, but I think it's a reality that all of us who have been keeping tabs on where this pandemic is in Maine appreciated, for example, with the high case numbers today. Brian, I think one note that I would offer is that analysis by our federal colleagues was done before Governor Mills's most recent policy announcement. So, for example, her most recent change last week to strengthen the mask mandate across the state. Those data were run before the governor's most recent executive actions. So I think that sort of is a sense of, well, perhaps these strengthened mandates will help us keep a lid on things. But again, given the ferocity, it's great that Maine was able to hold out, but we have now started going the way of other states. I'm going to turn over to Amy Brown next.
Thank you, Dr. Shah. A question from a listener to start with. Are churches considered public places and subject to the governor's new tightening on the mask enforcement?
Yes, they are, and they were previously considered to be public settings as well.
Okay. And you had said last Wednesday that we may need to continue masking and social distancing for a period of time after the vaccines are rolled out. How long do you think people will need to do that? Are you thinking most of next year? And you also said that those measures may be even more important as the vaccines are rolling out. Why is that?
Sure. So let's first talk about the timeline. And the timeline really does depend on how much vaccine there is and when we are able to reach certain thresholds at which different types of immunity start to be conferred. So I don't have a sense of how long that may be. It really is a function of how much vaccine we are able to receive and then how quickly we can start vaccinating people with it. But even after you reach certain thresholds of immunity, the virus is still circulating. There may be fewer and fewer cases each incubation period, but that doesn't mean that the virus has been vanquished. It is still among us. And for example, folks who may not be able to get vaccinated or who have not yet been vaccinated may still be at risk. And so that's why even after folks are vaccinated, there's still a need to make sure that for a period of time, we're all keeping up these physical distancing measures so we can try to drive the rates of new cases as low as possible. The reason that it may be as important, if not more important, is that for a period after, we have to make sure that folks don't let their guard down too early because we want to make sure we drive the rates as low as possible. The vaccine is a new tool that we will have, but it is in addition to the existing tools like face covering wearing and social distancing.
And so what's the time frame, do you think, on that then? All of 20?
It all depends on how much vaccine is produced and how much we are able to get it into people's arms.
Okay, thank you.
I'm going to turn over to Joe Lawler at the Press Herald next.
Yes, hi, thanks. I have a question here and then a follow-up. Can you say right now exactly or close to exactly how many deliveries of vaccine doses that we have, and is there a breakdown of the hospitals, versus pharmacies? And the second part to that question is, do you intend to eventually have this vaccine delivery data on the Maine CDC dashboard like all the other data?
Yes. So let me start, Joe, I'll take those questions in order. Thus far, given that this is week one of what will be a multi-week vaccination process, Maine has received its first 6 shipments of the Pfizer vaccine. That's 6 shipments of 975 each that have gone to 6 locations across the state that have ultra cold storage capacity. Those include Central Maine Medical Center, A.R. Gould, Eastern Maine Medical Center, Maine Medical Center, the Maine CDC, and one more, and Maine General. And so those are the 6 locations that have received the allotments of Pfizer vaccine. That's where they're at, and each received an initial allocation of 975 doses. Now, with respect to the data, we have put on our website the allocation spreadsheet. We'll send you a link to it, Joe, that lists exactly all of the information that I just outlined, and we intend to continue doing so week on week. We're simultaneously working to stand up a similar dashboard as with the other COVID-19 data that list, for example, how many individuals have been vaccinated in the last 24 hours, things of that nature. We're in the process of doing that. The data changed so quickly that we've just got to figure out what cut points in time we will report on.
Okay, thank you. And just my quick follow-up question is, once the mass vaccinations start in 2021, what do you think of the offer by the dentists and Maine dentists and dental hygienists to help out and be part of the vaccination team? Do you think that's something you would consider?
We absolutely would consider it. One of the rate limiting factors that we have to contend with is partly, as I kind of said to Amy, how much vaccine we've got, but another is the number of vaccinators we've got. Both of them, when taken in conjunction, will help us maximize the number of doses that we can get people to be vaccinated with every week. So absolutely, we're considering offers from members of the dental community, retired pharmacists, nursing students, medical students, all of those different vaccinator groups. We're now trying to consolidate all those and then figure out how to split them up across the state so we can get folks vaccinated. I'm going to turn over to Allison Ross next.
Hi, Dr. Shah. Thanks so much for taking my question. So more vaccine questions. We had some viewers writing in just wondering, why does the vaccine need to be so cold? Where are you really getting this dry ice? And how much was actually needed for this first round of vaccinations, if you know that number?
Yep. So as to why the Pfizer vaccine needs to be kept so cold, the way that this molecule, this mRNA molecule, the way in which Pfizer manufactured it is such that above a certain temperature, above -50 or so, like any other type of chemical, it starts to break down. Now, it doesn't break down immediately. In fact, the Pfizer vaccine, even though we've all talked about it needing this ultra cold storage, it can actually live outside of that ultra cold environment for a number of days. But for maximum efficacy, for maximum preservation of doses, the best way to preserve it, to store it, is in that ultra cold environment. And that is just because that is the environment in which it remains the most stable and has the least likelihood of degrading. Now, we actually did not need to utilize for this week that much dry ice. And that's because for months now, we have been working with hospitals to plan for and make sure they had ultra cold storage freezers. Maine CDC acquired freezers, both on our own and in partnership with some of our colleagues in the community. The hospitals did the same thing. Because we had been planning for this acquisition of ultra cold storage units since, I believe, early September, we actually didn't need to use that much dry ice. We were ready to. And in the future, we may need dry ice to ship the vaccine from point A to point B. Some of those shipments have already occurred. Some hospitals were sharing doses with one another. And when those transfers happened, they happened with dry ice. But because we had planned so early to have ultra cold storage freezers at hospitals across the state, dry ice was not our primary mode of storage.
Great, thank you.
I'm going to turn it over to Dustin at New England Cable News next.
Hi, Dr. Shah. First off, what are you seeing across the state as far as demand for testing ahead of the holidays? Does it seem like there are a lot of asymptomatic folks planning to travel?
Dustin, the answer is yes. We've heard, but I don't have data to point to in that respect. We've heard anecdotal reports of individuals inquiring about how they can get tested in advance of their holiday travel, or alternatively, if they've got folks coming to visit, how they can get them tested in accordance with the governor's executive orders. We haven't seen a numerical uptick, but as we get closer to the 25th, 26th, et cetera, it's possible that will increase. Dustin, the question I thought you were going to ask is, what have we seen in terms of the demand for vaccine? And even though that's not the question you asked, I will report that per email discussions I've had with chief medical officers across the state, demand among healthcare providers for the COVID vaccine has been very high. I know that's not the question you asked, but that's a tidbit to throw in.
That's fine. It speaks to the interim period that we're in, going back and forth between the two. I guess with that anecdotal evidence, I'll just follow this up, and then I have one other question. Is that worrying to you?
You know, in the ideal world, if COVID were the only thing that we were focused on, the best thing to do would be to stay home and stay within your pod. I recognize, though, that that is not something that's available to everybody. So this degree of travel is concerning. And whether it's travel in state or out of state, or whether it's just travel to see your brother across town and get together for a traditional big family dinner. It's the gatherings that cause concern. And it's not so much directly a function of travel, but it's the gatherings themselves. But here's the thing, Dustin. I've attempted to not be overly prescriptive in these discussions. My goal has always been to recognize that everyone's got competing demands in their lives and try to provide ways in which folks can do the things that they want to do safely. I believe that's a better way to go about having a dialogue with folks. Rather than speaking about what thou shalt do and thou shan't do, it's not an effective way to get folks to be on board. What I've tried to do is to say, this is the ideal, but that may not be something that's available to everybody because you want to see your family. And this is the time of year when loneliness, which has already been a problem in the pandemic, can be magnified tenfold. So if going to see your family is something that is a priority, what I would ask is that you do so in a manner that's safe. By which I mean, try to limit the time of the visit. Wear a mask even when you're inside. Try to be spaced out even when indoors as much as you can be. It's a risk, and we should acknowledge that it's a risk. But hopefully it's a risk that with proper safeguards can be minimized.
And jumping back to today, how fast could we run out of hospital beds if we keep seeing numbers like today's? And what does that mean? Is it something like field hospitals become necessary, that sort of thing?
Well, it's a number that we're keeping tabs on. As I mentioned, we are constantly keeping tabs on the number of ICU beds that are available, the number of ventilators. Although we have seen a record number of new cases, it may be of several days before those translate into hospitalizations, because there is a time between when someone is diagnosed and when their illness progresses such that they need hospitalization. We are still not at the point where a field hospital, for example, is a necessity, but it is an option that we are continuing to develop in case we get there. The first best thing that we can do right now, though, to prevent us from getting to field hospital stage is doing the things we've talked about. Wearing a mask, staying distant. That's the best way right now to keep the virus numbers down. I'm going to turn to Patty White at Maine Public next.
Thank you, Dr. Shah. You've given estimates before, but what is your current estimate, given the doses that we're receiving and the logistics involved, for when we'll be able to complete vaccinations for phase 1 and move to phase 2?
So Patty, even within phase 1, there are 3 specific demarcated phases. There's 1A, which focuses on hospital, healthcare personnel, as well as long-term care facility residents and staff. There's 1B, which as currently conceived, focuses on essential or frontline workers, and 1C, which focuses on older Mainers as well as those with serious medical conditions. 1A, just phase 1A, has roughly 100,000 people in it. 1B, depending on how you define frontline or essential, may have several 100,000 people in it. Just in those 2 phases alone, we could be looking at a third of the state in some renditions of the model. That throughput may require many months just to go through phase 1A and 1B. The reason I don't have a more firm timeline is that the estimates of how much vaccine is available are really what govern the velocity with which we can move through 1A, 1B, 1C. Right now, we don't really have clarity as to the estimates of what Maine may be allocated beyond week 3. We're in week 1 right now. And so we don't even really have clarity beyond the next 2 weeks or so. And that's why it's just really difficult from a projection perspective to provide what that timeline may look like. We want to be ready to move as quickly as possible through phase 1A and 1B. We're hoping it's on the order of several weeks, maybe, but it could very well be several months, depending on how much vaccine we get.
Okay, thanks. And you talked about the delivery that we received this week of the doses for hospitals. Did we receive a delivery for pharmacies for long-term care facilities? And you had said, I think, I don't know if it was Monday or last week, that could get rolling by next week. Do you still anticipate that?
So yes, Patty, let me answer the latter part first. Maine is part of a partnership with the US CDC, chain pharmacies, as well as some Maine-based independent pharmacies and skilled nursing facilities, whereby employees of those pharmacies will be going on site to offer vaccine to residents and staff. We have been briefed that the first such vaccine events of that nature will start this upcoming Monday on schedule. They may take several days, if not weeks, to move through all of the skilled nursing facilities in Maine for that first vaccine event, then the second administration event, and then the third. So that is on track, and we're excited that it will be beginning in earnest this upcoming Monday. As to your former question, those vaccine doses don't actually come into possession of Maine CDC. They are allocated and earmarked for the state of Maine, but they are held in reserve at a warehouse where the pharmacy chains themselves will divvy them up and send them out with their employees working in partnership with the long-term care facilities. So they are earmarked. There is presumably a pallet in an ultra-cold freezer somewhere that says Maine on it, but they are not sort of physically in our possession. Does that make sense? Or let me know if that doesn't add up.
No, that adds up. But I mean, are you notified when those arrive?
So it's not so much that they arrive. They may not actually be within the state of Maine itself. They may be at a staging area in an adjacent state or something of that nature and just be divvied up within the day or two preceding that administration event. We are notified because we have a line of communication with the pharmacies about when those different facilities will be have scheduled vaccine administrations, but the vaccine itself is not in our possession. It's earmarked for our use for Maine people and the vulnerable folks across the state, but it's not in our warehouse.
Okay, thank you.
Mm-hmm. I'm going to turn over to Evan at the Maine Beacon next.
Hi, Dr. Shah. Thank you. You said in the past that not enough federal funding for vaccine distribution could affect the velocity and the equity of vaccination in Maine. And I was wondering how you think a lack of sufficient federal funding might specifically impact efforts to get vaccine to low-income Mainers and Mainers of color, who, as you know, have seen high COVID disparities, and what the state's plan to mitigate those potential challenges would be if the funding doesn't come through.
Absolutely, Evan. I had the honor of speaking with and getting advice and feedback from the Permanent Commission on this exact issue earlier today. And with respect to low-income Mainers and Mainers of color, what we've seen thus far with respect to things like testing is that it may not be sufficient to have the vaccine just merely available in a community. There will be much more that will be needed for individuals for whom access to healthcare is already a barrier. There will be much more for them that will be needed in order for them to access the vaccine in high enough rates to protect themselves and their family. And getting to that level requires a number of things. Number one, it requires us to have a sufficient workforce of vaccinators who can actually conduct that outreach and offer the vaccine in those communities. It also requires us to be able to have communications that answer the legitimate questions that folks have, like some of the questions I talked about earlier. It also requires a system for us to be able to make sure we are transporting the vaccine to places that we know have been historically underserved in terms of healthcare access. Those are all things that we can plan around, but without the requisite and accompanying resources, those plans are just that, they're resources. Or they're plans, rather, they're not put into action. Now, we'll get the job done. We will be able to shift our assets and work in concert with partners, be they public health nurses, EMS, and other providers like Joe Lawler was asking about. We'll get it done. But if we had the resources, we can make sure that those plans were shored up and start putting them into action all the sooner.
Great. And I was also wondering if there are any plans to specifically provide the vaccine in one block to certain at-risk populations. I'm thinking like indigenous people or new Mainers, or would they just be put into phases based on things like age or risk factor or job?
Well, what I think is important there, Evan, is that the phases that we have right now and that we are contemplating are specifically designed with an equity lens in mind. So, for example, phase 1A, which is healthcare providers as well as vulnerable Mainers. Many new Mainers, many people of color, many individuals who are in marginalized groups work in healthcare, whether they be as nurses or environmental service workers, dietary workers. Healthcare is a large employer of those groups. Similarly, when we get to phase 1B, essential or frontline workers, across the state, across the country, the ranks of essential and frontline workers are occupied by people of color, people who have been historically disadvantaged. So we've designed the phases with that equity lens in mind, knowing that by putting those phases as 1A and 1B, we will simultaneously and in parallel be offering vaccine to those groups of color, to those who have been historically disadvantaged and marginalized from healthcare. So that is part of the process behind how we conceive of phases 1A, 1B, et cetera.
Great. And just one last question for you. I was wondering if you could talk a little bit about this Maine CDC's relationship with Indigenous health organizations throughout this pandemic, such as Wabanaki Public Health, and how you feel that relationship has gone and how you feel those public health organizations have done to help tribal communities weather the crisis.
Early on in the pandemic, we started a series of regular calls, Zoom meetings with the employees as well as the leadership of tribal health as well as Wabanaki Public Health. I believe those calls are still ongoing. If I recall, they happen every Friday. And they are specifically designed for the members of those communities and those health centers to make sure that their concerns were being voiced, their questions were being answered, and their requests for resources were being met. We've continued that, and those calls have been ongoing for many months now. I'm proud of the partnership and the relationship that we've developed with tribal health leaders and with tribal leaders themselves, as well as with our colleagues at Wabanaki Public Health. That relationship is continuing as we move into vaccine planning. One of the tribes has elected to receive its allotment of vaccine from the state of Maine. Other of the tribal health centers have elected to receive their allotment from the Indian Health Service, from IHS. But irrespective of where a particular tribal health center is receiving its vaccine from, we have tried to make clear that Maine CDC will still be with them every step of the way. If they've got questions about storage, administration, ordering of doses, Maine CDC will continue to be working with them so they've got their questions answered.
Thank you.
I'm going to turn to Bill Trotter at the BDN next.
Hi, Dr. Shah. Thanks for taking my questions. The first one I want to ask is about, you mentioned that long-term care facilities are next in line, part of the 1A group to receive the vaccine, and that you expect that to start on Monday in terms of distributing the vaccine through the pharmacies. Do you know how many such facilities there are in the state that will be receiving those vaccines?
Yes, 94.
So is that both nursing homes and assisted living facilities, or?
That is skilled nursing facilities, assisted living facilities, intermediate care facilities, and other congregate living facilities will be part of what is called Part B of the retail pharmacy partnership. We are determining, based on the allocations that we have been given, when we will activate Part B. It may be the following week, it may be the week thereafter, but we're starting, as is recommended by the US CDC, with Part A, which is skilled nursing.
Okay. And do you know, do you have an expected timeline of how long it might take to distribute vaccines to both the A and the B part of that grouping?
What we have been told by the US CDC is that the 94 skilled nursing facilities should have received their first round of vaccine clinics by the end of the third week of the program, which is the end of the first week of January. That all 94 should have, in principle, received at least their first round of vaccines. Now, we've been asking the pharmacies pretty hard questions about how many staff they've got, and whether they can really fulfill this promise that they've made to the US CDC as well as to the long-term care facilities. And we've been pushing on that because candidly, we've got concerns. So we hope that all of them will at least be able to get their first doses in place by that end of the first week of January. And we're going to be watching to make sure that they do.
Okay. And second question I have, you've referred to holiday gatherings as being kind of the primary point of concern about the spread of coronavirus. Are there other scenarios in terms of public exposure that CDC has seen that are higher risk than others in terms of contracting the disease?
You know, in recent weeks, Bill, the number of outbreaks, and I'm using outbreaks as a proxy because those are typically the situations that bubble to the top. Like that, going back to the pot of boiling water analogy, we know that there are cases everywhere, and we know that there will be bubbles that come to the top. We just can't predict where. Outbreaks are the manifestation of that higher and increasing rates of community transmission. In recent weeks, we have continued to see outbreaks at eating establishments. I mentioned one today. We've also, however, seen that increasingly when Maine CDC contacts individuals to talk to them about where they may have been exposed, individuals really don't report any association with a known outbreak. And so there are other scenarios, Bill, anytime that folks are out in public with people who are outside of that bubble, outside of that pod, there's the likelihood of exposure, is particularly if those gatherings are of long duration and high density. So those remain a risk. I think what we've seen as we've gone through Thanksgiving and now into the winter is that previously those public settings were the primary source of risk. But now what has happened is that those public settings remain a source of risk, but added to that is this new source of risk from smaller private gatherings. The risk from large public gatherings has not diminished. It's just been added to by smaller household private gatherings.
Okay, thank you, Dr. Shah.
Yep, thanks, Bill. And to round us out for the afternoon, I will go to Patrick Whittle from the AP.
Thank you very much. And thank you for everyone who asked my questions for me. But here are questions numbers 5 and 6 on the depth chart. So the number I believe was we have 475 recipients, is that right?
That was as of 158 or so, Patrick, right as I was logging on. It has invariably gone up, but yes, at least that number.
And has it been administered yet to residents of long-term care facilities? Or do we not know?
No, the answer there, Patrick, is not yet. The first residents of long-term care facilities will be receiving their vaccines starting this upcoming Monday.
Okay, terrific. And in which phase are residents of, is there a difference between a long-term care facility and a nursing home in terms of when they'll be able to receive it?
Yeah, so a lot of the terms get thrown around and some of them are interchangeable, some are not. What we're talking about as part of this Part A, this first phase of the pharmacy partnership is skilled nursing. Those are individuals who are the most medically vulnerable, who require the most intensive nursing care. Where we will move after that are places like assisted living and other congregate living settings. Well, all of that is known under the umbrella as long-term care. And the, I think, more colloquial term for all of long-term care is nursing home. But within both of those terms, there are degrees of intensity of medical risk, medical vulnerability, and thus needs for higher rates or earlier vaccination.
Okay, got it. There's been some discussion about the importance of getting it out to the broader community to halt the spread, but I don't think that we have really good information yet about whether or not this will actually end slow or halt transmission. Could you talk about that a little bit?
Yeah, Patrick, that's been on my mind a lot recently. There are some data that were noted by the US FDA in Moderna's scientific review of their vaccine that were the first glimpse at the extent to which the vaccine may not just reduce the likelihood of spreading the virus and having severe disease, but also reduce the likelihood of even harboring the virus. There's much more data that will be coming out about this from what I understand, but there appears at least to be good reason to think that the virus not only protects you from getting severely ill, but it also reduces the likelihood that the virus could, say, for example, exist in your nasal passages and still might be spread from person to person. It appears that the vaccine has good promise at reducing the likelihood of even having the virus hang out in your nasal passages. But there's more science that's being done there. To your real question, or the question behind your question, Patrick, is what will the rollout of the vaccine mean with respect to things like the number of new daily cases, as well as potentially even the tail end of the epidemic? And what I will say there is that unfortunately, epidemics don't really end the way they started. Typically, epidemics start with a bang, but they often end with a whimper. Or to put it in sort of different terms, they end with a very long tail. There will be cases of COVID-19 that persist even after folks start getting vaccinated in earnest. Hopefully those numbers will go down. Some epidemiologists have speculated, or have modeled rather, that the number of new daily cases may start going down when folks get to around 50% vaccination. That's actually something Dr. Fauci talked about last night and this morning. Other models have it at a little bit higher. The vaccine rate goes up and up and up. We expect commensurately the rates of new cases to go down. But by the time we say that the pandemic is over, it's a very, very long tail. And so it goes back to something I talked about last week. It's like a train that's speeding down the tracks. There's a time between when the brake is applied and when the train ultimately stops. The vaccine is that brake. It'll just take a long time to stop the train.
If I could close with sort of one more thought here. Where you began today sounded a bit like the beginnings of sort of like a public education campaign, which I'm assuming the state must be planning or probably has planned at this point. Can you give us an idea of what that's going to look like?
Yep. So there are sort of two, maybe even a third parallel set of public education, public awareness, public empowerment campaigns that we're thinking about, all of which are designed to instill, inspire confidence in the vaccine. One of which will be under the auspices of what we're told is a national campaign that will be done in conjunction with the US CDC, the Ad Council, and a number of other groups. That'll be a national level campaign. We're working right now to particularize that to Maine, because there may be questions that are specific to Maine's population as well. We are also, and this is something that I had the privilege of meeting with the Permanent Commission on to talk about, thinking about ways we can empower and inspire confidence in communities that may have additional questions about the vaccine, communities of color, communities that have been historically disadvantaged. We're working on all of those right now. Candidly, those campaigns take a while to start, they take a while to launch. And I didn't want to wait for that. And that's why today and on an occasional basis, I will collate the most frequently asked questions that we see the most, and just use this opportunity as a way to speak directly to folks so that the questions that we see that are timely are getting answered in a similarly timely fashion. My goal in doing so is to get ahead, or ideally even stamp out misinformation or confusion, or even worse, conspiracies and rumors about the vaccine. We are in a situation, as Mark Twain said, where misinformation can get its way around the globe before the truth even has a moment to put its shoes on. With the vaccine, given everything that's at stake, my goal in taking some time out of these briefings to answer these frequent questions is to try to stamp those things out and empower people with the scientific facts before they spiral out of control. So thanks for raising that, Patrick. And thank you for everyone, both to our colleagues in the media for teeing up the questions this afternoon, as well as for everyone who's tuned in this afternoon. As I just mentioned in connection with Patrick's question, we're going to start trying to find new, different, and additional ways to empower and instill confidence in the vaccine. I've got confidence in the vaccine, and when my turn in line is there, I'm going to be taking it. But I know that others have questions. That's natural. My goal is to try to take those questions and answer them honestly, openly, and respectfully. It's natural right now where we are in the world with so much anxiety around COVID and now a new vaccine to have honest, heartfelt questions about it. I don't want folks to be shy about asking those questions. I'd rather you ask those questions and get straight, scientific, truthful answers from folks like me and my colleagues at the CDC than not ask those questions and harbor doubts. Or even worse, ask those questions in a venue where you may get misinformation. Keep asking those questions. I pledge to try to answer as many of them as we can from time to time in a manner that is open, that is scientifically based, and most of all, in a manner that is respectful. So with that, I thank everybody for your time this afternoon. We will absolutely have more updates as we go through the week. With that, I look forward to catching up with everyone on Friday. In the meantime, as always, please be kind, take care of one another, and stay vaccinated as much as you can. We'll talk again on Friday.